Ako sa inyo sa mga nag-shares ng videos at nag-like, continue sharing the videos. Ang topic natin, it's part 3 ng low back pain. Alright, so mag-a-advance tayo ng exercise. May pasyente ako, may nag-message sa akin about scoliosis. Scoliosis is very hard to na topic kasi mahirap kailangan ma-analyze natin yung curvature. Okay? Just 1 minute, I'll be right back. I just lowered the volume sa radio. Okay, so guys, the low back pain, generalized siya, no? It can be from disc herniation, pwedeng disc herniation, or patients with scoliosis. A scoliosis would be like this, yung may C-curve or S-curve. Alright, so yan ang scoliosis. It can cause low back pain. Yung iba pa is if they have degenerative changes, like arthritis of the back. So napakasakit niyan, especially as we get older, more than 40 years old, okay? So madaming general reason kung bakit tayo nagkakaroon ng low back pain. Pwede rin sa sacroiliac, which is controversial, okay? Disc herniation, lumbar spine arthritis or stenosis, okay? At scoliosis. So, ang topic natin is yung mga basic exercise. Likes and hearts naman dyan, guys. Likes and hearts. I want to see likes and hearts po, okay? Alright. Yung mga low back pain, madaming reason siya. So, kung may sumasakit sa inyo while you're doing your exercise, yung mga tinuturo ko exercise, you have to stop. Kailangan itigil nyo kasi it may cause increase in pain. It can be yung mga bawal na exercises, lumbar spine stenosis, kailangan bawal kang mag-hyperextend dyan. Kung may disc herniation ka, mahirap magkukos ng pain pag flexion. Okay? Now, we're gonna start with the basic exercise, like pelvic tilts. So, importante, malaman natin kung paano yung tamang pelvic tilts. Okay? Pelvic tilts means, kailangan neutral yung position mo. You can do, this one is what we call round shoulder. Very common siya sa mga may lumbar spine stenosis, nakakuba. Kasi it's a position of comfort, okay? Now, there's a lumbar spine lordosis, means naka-extend, naka-lordotic siya. Yung naka-stick out. So those are two bad posture. Kailangan malaman natin kung paano yung neutral position. So, not exaggeration, not this, but it should be in neutral position, like sa belt line nyo, okay? So basic yan, para yung muscles nag-i-engage. Alright, now we're gonna start with pelvic tilts first. Para sa mga may low back pain, I'll talk to you about scoliosis mamaya, okay? May nagtatanong sa akin na about scoliosis. Let's start with the exercise. Magandang umaga sa inyo, guys. Alright, so when you say, let me adjust this. I-move natin ng konti yung camera para makita nyo. Okay. So, pelvic tilts would be, pwede nyo ipunta yung kamay nyo sa likod, okay? You press it down. This actually feels good. Press down to do your tilts and then release. Press down and then release. Ito yung basic exercise sa mga low back pain. Press down and hold it for 2 seconds and then release. The key is you're pressing your hands, okay? Pinuput nyo yung pressure nyo sa kamay. Ipe-press nyo. Nakikita nyo yung kamay ko, nasa arch siya, okay? Press down, hold it for 2 seconds and then release, okay? So once you learn that pelvic tilts, you're good to go. Alright? Now, number 2 exercise, you're gonna start to do trunk rotation. Very good to sa mga pasyenteng may lumbar spine stenosis. Okay? You're doing trunk rotation just like that. Going side to side. As you can see, I'm stabilizing my back. Alright? So you're gonna do trunk rotation, hold it for 5 seconds. Back and forth. 5 seconds, back and forth. Okay? Yan. Lalo na maganda to sa mga lumbar spine stenosis. Side to side. Hold it for 5 seconds. And then back for 5 seconds. You start with 10 repetitions. Okay? So, I don't have low back pain. So, I'll show you kung paano yung get up from a bed. Kung may masakit yung back nyo, you go this way. You go to the side and push it with your hand. Alright? Kung masakit yung back. I wanna see likes and hearts, guys. Pusuan nyo naman ako dyan. Okay. So those are the two exercises. One, pelvic tilts. The other one is trunk rotation. If you have any pain, good morning, Nonette. Good morning, Michelle. Good morning, Des. Hi, Joe, Rara. How are you? And Diana. All right. I want to see hearts and likes para mas ganahan tayo mag-exercise. Okay. Kung sino man sa inyo, you can follow me do this exercise. Okay, guys? We did pelvic tilts, trunk rotation. Hi, Ruth. But if any of those trigger pain, you stop. Okay? Those are two basic exercises. Now, I'm gonna show you how to strengthen your core. Pagka sinabing core exercise, hindi lang yung stomach nyo, hindi lang yung abdominal muscles. Kailangan you strengthen your back and your abdominal muscles, okay? This is your back extensors, your abdominal muscles, all right? So the bridging exercise, ipapakita ko sa inyo yung bridging exercise. Very effective sa mga to strengthen it. Lalo na pagka wala na kayong pain. I-add nyo to sa exercise nyo, okay? Hi, Vina. Hi, Mabel. Alright, keep sharing po. Share our videos. Alright, guys. Okay, let's start with the bridging. Okay, bridging exercise. So make sure, pagka nagbe-bridging kayo, you put your hands dito sa gilid, okay? Para may stability kayo. And make sure you tighten your stomach. And then slowly lift your pelvis up. Okay? A good pelvic tilt would be you doing it segmental. It means you feel the movements of your spine. Alright? Segments by segment. Ibig sabihin, you feel it moving. Dahan-dahan lang. And you hold it for 2 seconds to 5 seconds. It depends. If you have pain, you stop, okay? And then bring it down slowly and keep it in a neutral position. Okay? Keep it tight. Alright? I'm tightening my stomach and then I'm lifting my pelvis up. And you hold it for 5 seconds. That's a very good core exercise. It looks easy. Kala nyo madali siya. It's very hard, lalo na sa mga low back pain patient. Usually, they have weakness of the core. Okay? Now, paano natin mapalakas ang core natin? Alright? So, that's a basic exercise. Huwag kayong mabilis na ganon. Wag ganon. You have to do this slowly. Hold it. And then back slowly. Keep it tight. And then up and down. And slow. And then up. If you can hold it for 2 to 5 seconds, that's good. Alright? Another one, the progress on this one is, para mahirap siya, mas mahirap, you can put your hands across the chest. This one is harder. Okay? So hold it for 5 seconds, and then bring it down slowly. Yung kamay nyo nasa chest, guys, alright? Magandang exercise to strengthen your core muscles. Up and down. Okay, make sure you keep it tight. Alright, up and down. And 10 repetitions. Okay? Alright, so I showed you pelvic tilts, trunk rotation, the right way of bridging. Sometimes sinuturuan tayo ng bridging pero hindi sila nagbibigay ng tamang instruction. So yung bridging exercise, kailangan dahan-dahan lang tayo, ha? Yeah, dahan-dahan. Hindi siya mabilis. Hindi siya jerky movements. Slow and steady. Alright? Okay. Number 4, we're gonna do, so we did the pelvic tilts, we did the bridging, the trunk rotation. We're gonna do cat and camel, or cat and cow, or cat and dog. Alright, so follow me with this one. This is, nagawa ko na to last part 2, pero I wanna make sure tinuturuan ko kayo ng tama. Okay? Alright. So, cat and camel. So, the right way is, this is your dog. Alright? So, this is a very good exercise. You try to move slowly. Make sure the spine is moving. Maganda to sa range of motion exercise. So, nagagawa ko na lordosis. And then, this is the cat. Alright? Hold it for 2 seconds. And then back. 2 seconds. You can do this slowly, kagaya ng bridging. Again, if you have any increase in pain, you stop. That feels good. Alright, so that's good. Now, you're in this position. We're gonna add, to strengthen our core and our back extensors. Initially, you can start with this. Okay, you can start with one arm, all right, or alternate. Okay, alternate. And you can actually feel it in your back extensors. All right. Now the progression of this is, guys, is you do one arm, and make sure your core tight siya, okay? Tight yung core muscles mo. So you're doing up, and then back, up, back, okay? Again, up, up. Make sure your core is tight, okay? Now, this one is harder. Kala nyo madali siya. Napakahirap nito. Okay? Mahirap itong gawin. So, make sure you don't have any pain when you're doing this. Okay? Neutral position. So, I'm doing the legs. And then we alternate. Okay? You see my arm? I should be in neutral position. Back. Alternate. Okay? Like that. And hold it for 2 seconds to 5 seconds. See, like this. One more. Okay, last one. Okay, good. Okay. Those are strengthening exercise to improve your core. Hi Rowena. Hi Ruben. Thank you sa mga top fans ko dyan. Keep sharing. Nagpapasalamat ako sa inyo. Benson, Rowie. How are you guys? Marie. Thank you for watching. Okay. So those are really great exercise. We did the pelvic tilts, the bridging, the trunk rotation, the cat and dog, progression of the cat and dog. And then I'm gonna show you last one. So, sa pasyenteng meron dyan, hi Magdalena, may scoliosis, which is they have low back pain. Okay? So, etong scoliosis means yung spine niya is nakaganyan. So, ibig sabihin, ang spine niya nakaganon siya. Or it could be twisted like this. See that? Ang scoliosis is a different topic yan eh. Mahirap i-discuss kasi I'm not seeing you, hindi mahirap i-evaluate yung scoliosis. So this strengthening exercise is general exercise or stabilization exercise. Is general for patients with C-curve or S-curve. We don't know kung ano yun. Kailangan tumingin kayo ng physical therapist para ma-assess kung C-curve kayo or S-curve. Okay? This is the last exercise, guys. This is my last exercise. Continue doing this at home. Okay? This is for scoliosis. We use this one for patients with spinal stenosis too. Okay? So for patients with scoliosis, I do what we call prayers position. Contraindicated to sa mga pasyenteng may hip replacement, okay? Or patients with disc herniation. So if there's any increase in pain, you stop this. So patients with scoliosis, you just stretch it like this, and you hold it for 5 to 10 seconds, okay? And then, you start moving the arm sa left side nyo. I-stretch yung other sides of the spine, okay? Alright, you hold it for 5 to 20 seconds. It's up to you. And then you go back. And then stretch again. And you go to the other side. Just like this. Alright, hold it. Hold it for 5 to 20 seconds. And then back to neutral. This actually feels good for me. Masarap siya. Go in. Alright. Forward flexion again. I-move nyo yung katawan niya sa kabilang part. Hold it for 5 seconds. And then back to neutral slowly. Last one. Move your trunk forward. And then rotate to the side slowly. Okay? And then back. Alright. That's my last exercise for you guys. So those exercises are very effective. It's an advanced exercise. I showed you the cat and dog, how to strengthen your core muscles. Again, if there's an increase in pain, you stop doing those exercises. But this basic exercise are gonna help, makakatulong sa inyo para gumaling yung low back pain nyo. Alright, libre lang to guys. I know sa Pilipinas, it's very expensive. Per session dyan, it's a lot of money. So, nagpapasalamat ako sa 16,000 followers dyan. Continue sharing our videos para makatulong tayo lalo. Until mag-message lang kayo kung ano yung gusto nyong i-share ko sa inyo. Makakatulong to sa kapwa natin. Nagme-message sa akin from Romania, England, from Singapore, Dubai, Philippines of course. And I'll see you again. I'll see you next week. Alright, bye-bye. Good morning. Good morning, sir. Miming, Ruel, paring Ruel, Jane, how are you? Elena, Eleanor, Magdalena, Atenel. I'll see you. Maraming salamat. Mabuhay. Take care, guys. Bye-bye.